Welcome back to another episode of Drug Talk, everybody. In today's video, I'm going to go over the top 10 most frequently asked questions about Cialis or Tadalafil. Number 1. What is Cialis and how does it work? Cialis is a PDE5 or phosphodiesterase 5 inhibitor which relaxes blood vessels, increasing blood flow to the penis during sexual stimulation. This helps to achieve and maintain erections. It does not cause arousal on its own, so you do need that sexual stimulation to achieve an erection. And just a side note, it's also available for BPH symptoms such as urinary issues. Number 2. What are the available doses of Cialis? Dosages typically include 2.5 to 5 milligrams for daily use, and then you would see 10 or 20 milligrams for as needed use, typically for sexual activity. Your doctor may choose to adjust your dose based on response to the medication and different health factors. Number 3, how should I take Cialis? So you'd want to take this medication with a full glass of water. For as needed use for sexual activity, you would typically take 30 to 60 minutes prior to sexual activity, although some sources also say to take it 2 to 4 hours prior. For daily use, you would just want to take it at the same time each day and never exceed more than 1 dose per day. Number 4, how long does Cialis last? The effects of this medication can last about 36 hours, with some sources saying about 48 hours, giving this pill the nickname the Weekender. It's kind of given this nickname because if you take the medication on a Friday, you're really covered for the weekend in terms of achieving and maintaining erections. Daily low doses provide continuous readiness. Number 5, what are the common side effects of Cialis? Some common side effects include headaches, indigestion or muscle aches, flushing and nasal congestion are possibilities as well. And then there would be some serious side effects like priapism, which would be a prolonged erection lasting greater than 4 hours. Also, another serious side effect would be sudden hearing or vision loss. If you experience priapism or the loss of hearing or vision, you would want to seek medical attention. Number 6, can I take Cialis with alcohol or other medications? You would want to limit the use of this medication with alcohol due to the increased risk of low blood pressure, although small amounts of alcohol are typically okay. If you're a heavy drinker and you use this medication, it could also increase your risk of dizziness. It's contraindicated to use Cialis with nitrates. You cannot use this medication with nitrates, and it also has some interactions with alpha blockers, a blood pressure medication, and antifungals. Certain antibiotics may also interact with Cialis, so you just want to consult your physician on the medications that you're taking with Cialis. Number 7, is Cialis safe for daily use? So yes, we kind of covered this in one of the other questions, but 2.5 to 5 milligrams is approved for daily use, and that would give you that constant, continuous readiness, and it would also be used for symptoms of BPH. It is generally safe to be used long term, but you just want to monitor for side effects. Number 8, who should not take Cialis? So like we mentioned, you would want to avoid if you take nitrates as one of your prescriptions. If you have severe heart, liver, or kidney issues, you would also want to potentially avoid this medication. If you had a recent heart attack or stroke, or had low blood pressure, you should probably avoid Cialis. If you had certain eye conditions, you may want to avoid this medication, and also it should be avoided in women as it's not approved for women, and it shouldn't be taken in males under the age of 18. Number 9, does Cialis protect against STIs or pregnancy? So no, it only treats erectile dysfunction, and like we mentioned, that daily dose for BPH symptoms. It does not prevent HIV, STIs, or pregnancy. So if you want to avoid pregnancy, you should always use other forms of contraception or condoms. And number 10, how effective is Cialis compared to Viagra? So both of these medications are effective PDE5 inhibitors. But it should be noted that Cialis lasts longer, like I said, 36 to 48 hours, where Viagra typically only lasts 4 to 5 hours. So Cialis may be better for spontaneity, and Viagra acts faster. So depending on the situation that you're in, you kind of choose which medication works best for you. And that's all we're going to talk about today with the top 10 most frequently asked questions about Cialis. But before you take off, I wanted to remind you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.